Every year, the World Health Organization and its committed partners all over the world celebrate World Hand Hygiene Day as an act for health workers and to emphasize the hand hygiene importance for the general public. This year, the slogan is in your hand, prevent sepsis in healthcare. Although 80% of sepsis occur outside of the hospital, but hand hygiene plays a huge role in prevention of hospital-acquired infection, which could lead to sepsis and death. And there are estimated about 30 million of patients are affected by hospital-acquired infection, and the rate is rising rapidly. Therefore, we urge you to fight against sepsis in the context of hand hygiene and infection prevention in healthcare.
Sepsis is the body's overwhelming and life-threatening response to infection that can lead to tissue damage, organ failure, and death. In other words, it's your body's overactive and toxic response to infection. Any type of infection, bacterial, virus, or fungus, can lead to sepsis.
So someone will be diagnosed with sepsis when they develop certain signs and symptoms. And sepsis can quickly progress to a more severe form, severe sepsis, and this is when they develop other organ dysfunction. So for example, if the lungs are affected, the patients will have difficulty breathing. If the kidneys are affected, the urine output will be reduced. If the liver is affected, there will be abnormalities in the liver function test, and also if the brain is affected, the patients may become more unconscious, more drowsy and confused. So all patients who have severe sepsis should be treated in the intensive care unit or the ICU. And eventually, if the sepsis is not controlled, they may develop septic shock. So septic shock is when they have severe sepsis that was described earlier, and on top of that, their blood pressure drops as well. So it drops to a very dangerous level, and this could eventually lead to death.
Hospital-acquired infection or healthcare-associated infection are infections that a patient acquires during their hospital stay or stay in a healthcare facility. It may also appear after the patient has been discharged from the hospital. It is a major concern for patient safety and it also comes with a high cost, not just to the patient and their families, but also an additional financial burden to the healthcare system. It not only prolongs hospital stay, it also increases resistance to antibiotics, and it causes significant disability as well as death.
One of the prevention that we can do is to use good hand hygiene. To many, hand hygiene has been described as one of the best single most important tool in preventing the spread of healthcare-associated infections. Not only does it prevent the infection spread between patients, but also between patients and of the visitors coming to the hospitals. One must understand that infection can spread not only after you've handled biological materials, after doing activities such as intravascular catheter care, but also infection can still occur in so-called clean contact, the times where our healthcare workers take a patient's pulse, the temperature or blood pressure. Infection in these conditions can also spread and result in disastrous outcomes. It is therefore important that hand hygiene and hand washing be done not only after you touch the patient, but also this environment. And it's important also to ensure that the environment remains clean at all times. While it may sound easy that hand hygiene just involves a simple solution of washing hands, keeping it clean, it's easier said than done. And most times what we found is many visitors and many of the healthcare workers themselves actually practice poor compliance to the standard technique that's been taught.
One of the reasons why healthcare workers especially, not to say refuse, but they don't really take time to wash their hands is because pathogens are invisible. So unless we feel that something is sticky in our hands, then we we kind of force ourselves, or not really force ourselves, but we will want to wash our hands. Since there is none, so most people would skip the step. And of course, the other reason mostly is because maybe we are in a rush and everyone is busy rushing for the next step or the next thing to do, so we kind of skip washing our hands in between seeing patients and in between doing procedures on the pretext of no time.
I think the best way to approach hand hygiene is to develop a behavioral approach where it becomes a subconscious thing, like they do it without even having to think about it, just like wearing seatbelts, like you get into the car. I think every one of us have developed this habit, and this is where we need to go, what we need to do with hand hygiene. For those who are natural at this and it has been ingrained in them, we can appoint them as champions in hand hygiene, and I think we've done that in this institution. And these champions can help promote and can help train others to do hand hygiene.
The 5 moments for hand hygiene are: moment 1, before touching a patient; moment 2, before a procedure; moment 3, after a procedure or body fluid exposure risk; moment 4, after touching a patient; moment 5, after touching a patient's surroundings.
Okay, it is very important to perform hand hygiene during this moment, because this is first to protect the patient from pathogens from the hand of our healthcare worker. It's also to protect the patients from potential pathogens, including their own, from entering their body during a procedure, and to protect yourself, our healthcare surroundings, from transmission pathogens from the patient. And lastly is to protect yourself and the healthcare surroundings from pathogens from the patient's surrounding.
How clean are your hands? Do you know that there are 5 moments of hand hygiene? Our medical and nursing students did a survey amongst patients, their relatives, and healthcare workers on hand hygiene. We took handprints for culture among those we surveyed before and after hand washing, and this is what we found.
As you have all heard, the hand hygiene slogan for this year is "It's in your hands, prevent sepsis in healthcare." Hospital-acquired infection is the most common adverse event in healthcare delivery today. More than 1 million patients are affected worldwide yearly. This is because hand hygiene is the most effective and cheapest method of preventing hospital-acquired infection and the transmission of organisms to the patients from the hands of the healthcare worker. Therefore, I, on behalf of the Infection Control Department and the Infectious Disease Unit, say to you, come, let's work together to reduce healthcare-acquired infections in PPUM by improving our hand hygiene practices.